quite a profit, which is greater than other states throughout the United States. And then they looked at 5 key findings, and we've already gone through some of the other ones with the hospital. But one of the things that I think is important is that uncompensated care in Colorado right now is very, very low. It sure is a lot lower than it is in New Mexico. Cost shifts are driven by strategic decisions. And I think this is a really important thing when we start looking at single payer plans. And that is when you have hospital systems that basically demand a large proportion of patient lives, what happens is that you really don't have to, you don't have a lot of competition. And so cost shifts are driven more by strategy. How are we going to keep those patients in our hospital group? How are we going to be able to become, in many ways, less competitive? And so basically this report found is that there's no longer the evidence that shows that hospitals can generate these high profits because of uncompensated care. And it's basically more about them trying to consolidate and get a larger share of the market. The Colorado Health Institute, in response to the cost shifting report, basically did their own publication, and they called it the cost shift myth. And that is that basically, when you get down, the most important part is that private insurance primarily are on competitive markets. And because of that, hospitals have market power and they can charge higher prices regardless of uncompensated care. And that is one of the things that the Healthcare Council is addressing under Lieutenant Governor Primavera. So I wanted to talk to you a little bit about my neck of the woods, which is Heart of the Rockies Medical Center. It is a 25-bed hospital. It has, it's an integrated system, meaning that it has a hospital, it has an outpatient clinic where they have primary care and specialty, and then it has its own, basically facilities, surgery, dialysis, and things like that. They just came out with their audit, and that was in the Arkansas Valley Voice. And so here's what my little hospital is doing. So we have now an operating income profit. In 2019, if you guys look at it, it's 8,206,000 and so on and so forth. In 2020, it was 2 million and change. And in 2021, it was 9 million, almost $10 million. Now, the reason that this is important to me is because in my county and with the League of Women Voters, we are trying to address what I consider to be upcharging. And the upcharging with the Heart of the Rockies is a real problem in our county. If you have no insurance, they will charge you whatever they want, and they have their charge master rates. And I think I've mentioned before, for a dear friend of mine who is a nonprofit employee, she could not afford her husband's health insurance. And he had to have a simple removal of his great toe due to an infection from diabetes. And they charged that family $12,000 for an outpatient procedure, where when we called around other parts of Colorado and all parts of the country, the rates for that same procedure varied from about $4,000 to $5,000. And they would not, I know personally, they would not negotiate with her or anything. They said that they're the only provider in the county. They do a lot of uncompensated and uncompensated care, as well as inadequately compensated. And that's what we're hearing as citizens of Chaffee County, and these other reports are disputing that. So that's all I have, ladies. Oh, these are the operating expenses of Chaffee County's hospital. Salaries and benefits, you can read this, but you can see salaries and benefits are the greatest amount. And then there are supplies and so on and so forth. But my opinion, and we're getting ready to elect a new board for medical center. My opinion is that we're going to ask these folks what they think about the charges that they have for uninsured when we start having opportunities to speak with the candidates. So that's it.
Wow.
Carol, will you either post your PowerPoint in the forum, or will you send it to me so I can? Is that all right?
Oh, sure. I'll be glad to do that.
Great, thank you. Questions? Linda.
Yeah, Carol, thank you for going through that report that the rest of us didn't take time to read and kind of dissecting it for us. I'm wondering how you, are you coming to the convention, the national convention?
I don't know. It conflicts with a great granddaughter's birthday.
Oh,
So I haven't quite decided yet what I'm going to do.
well, I'm asking
But
because,
anyway,
you know, there is a concurrence on digital equity that is really trying to address some of the issues around what you're talking about. You in the rural areas that just don't have the cluster and the intensity of medical facilities access that we have. And they're looking for someone from Colorado who's planning to be at the convention, to be at that caucus and talk about some of these issues that you have as a rural person. You know, there's a rural healthcare affinity group as a part of our national network. And this kind of dovetails not only with our healthcare concurrence that we're working on, but also one around digital equity. And I think that some of the points that you make really dovetail with that beautifully. So I'd love to find somebody else from rural Colorado who's going to be a convention delegate that might be able to come and talk about some of these issues and how, you know, the digital piece would help you.
Yeah. Well, I'll get back with you about what I'm going to do.
Yeah. And maybe you're not there, you know, maybe you can come part of the time as an in-person delegate, and then the rest do by Zoom, you know, so you can still get to the party.
Yeah.
But thank you.
So what do you think about getting the Department of Insurance person to address us, or get I tried very, very hard to get somebody from the Department of Health, Finance, and Policy. They are still not staffed very high because of COVID. And they, you know, they were very gracious. They gave me a bunch of links, but they said they just don't have the manpower for that. I don't know if he or an associate would be able to speak with us, but what they're trying to do is really pretty impressive. They are really making certain that we start getting these healthcare costs down, because they recognize what it does, and that basically it takes money from teacher salaries and other very important things that Colorado needs to do, but we spend a lot on healthcare.
Do you know for sure that they're really serious, or are they trying to avoid single payer healthcare?
You know, they're kind of doing it in parallel. They know that single payer health care is down the road, and what they're trying to do is to get premiums down by 2023, and that's their goal. And they're sort of, I think that they're leading country in how they're approaching that. And the way they're approaching it is that they're giving, I'll give you an example. Kaiser Permanente, which works very, very hard to keep overhead and other things down so that they can keep the premiums down for its employers. They have a little handheld app on all of their doctors, because you know it's an integrated system. The doctors, clinics, and the hospitals are all integrated. And so they have an app for all of their primary care doctors that says and gives an overview of their specialists, their outcomes, the cost per patient, and so on and so forth, so that they can start making some decisions about where they refer patients for specialty care. They've already got that started in Colorado now, so that's available for any primary care doctor in Colorado. Those are just, I mean, you think that's a small thing, but it's not, because when you see a patient, you refer him to a specialist, and that specialist does a whole battery of tests that may not be necessary, then you're keeping the cost of healthcare at a higher level. The same thing is true for pharmaceuticals. There's an app that lets you know in Colorado how much a particular medication costs, so that when you're making a decision, you've got a patient that you want to give them an antihypertensive or an antibiotic or whatever, that lets you know immediately per health plan. That's what's impressive, is it's per health plan what that's going to cost the patient, both copay, and then when you look at the backside, how much the pharmacy or provider of the pharmaceutical is going to charge the health plan. There's a bunch of things that they're doing that are very innovative, and they are holding the healthcare insurance providers to keeping their healthcare costs even and then decreased. So, and I think they're trying to do that to make some inroads into the costs that they have. And I think they're doing it parallel with single payer plan. That's my opinion. That's just my opinion.
Carol, do you think that this person you were suggesting come and speak to this committee would want to have a wider audience? Because I'm thinking that, you know, for the time and energy put into having this discussion, maybe there are some allied groups who would be interested in this, that we could go wider than the 10 or 12 people that come to a committee meeting.
I was thinking the same thing. Should this be, you know, a statewide presentation? Is it in alignment with league positions and principles? Certainly principles, but that's what I would want to ensure. But it sure sounds to me like it is. I mean, and you seem to agree, Linda.
Yeah, well, I'm not sure the full scope, because I don't know what Carol was thinking in the conversation, but I think it is good to know what the state is doing to try and hold healthcare costs down. And if there are ways that the rest of people in the state could advocate and applaud or push them further or make sure their tails are covered, we should do that. But it would take a little bit more conversation, like what's the real vision? Why do we want to do this? What's the outcome that we expect? Is it just an education? Is there some action component to it? Those are the kind of questions I would ask.
And that leads me, oh, Marilyn?
Yes, I come from might be a different point of view. I do like the direction that the league is going with single payer, but I don't know if you guys saw what was in the Denver Post today about lowering cost promise, but often mergers haven't helped patients. And I'm seeing a name of a guy called Alan Baumgartner, an analyst who studies healthcare markets in Colorado and 5 other states. And he's talking about hospital merging, because what we did have in 2009, we had 24 hospitals that they were studied and 41 in 2020. So, you know, and I know, you know, Carol, you're saying, you know, really your hospital, you said had 25 beds, but they had to be 50 beds to be in the report. Is that right?
No, they had to be greater than 25 beds.
Oh, great. So does your hospital have 26?
No. Nope. No, and it was not part of the data, because I asked them.
Well, see, that's leaving out. No, that's leaving out the important things that we need to address, you know, I think, in that area. Because what insurance companies do is they charge you for their services, and it runs around 15 to 17%. And I did, you know, I worked for an insurance company that did Medicare for 6 years, so that's where I'm coming from. And I'm also coming from the fact that the privatization of traditional Medicare is happening right now. It happened to me without my permission. So I just want to make sure the league address those issues. I'm just very strong about that, and I'm going to be there at the convention. I'm not a very good speaker, but what I'm saying is we can find somebody that would give the Medicare, because what's going to happen to the people on Medicare, I'm going to be on Medicare for the rest of my life. So, and there's a lot of us in that age group who we're in the Medicare group, or we're in our 60s, and we need to decide which way to go, whether it's going to be Advantage Medicare, Medicare Advantage, or traditional Medicare. And it looks to me like Advantage Medicare is winning out. And I don't think people know what it is, what traditional Medicare is. Both my husband and I have it. So I'm very familiar with that.
So that leads me, everybody, is that I think we need to figure out what our goals are as a committee. I've always been taught to be figure out what goals are. And then when we figure out our goals, then I think we could figure out how we could make this more available to the rest of people who are members within the state of Colorado.
I think
I know
probably
that
education of ourselves is probably the biggest thing, don't you think?
Sure, yeah, I mean, we determined that early on, but how do we want to, we wanted to get educated about hospitals. I personally want to get educated about what the state's doing and what legislation.
I agree with that. I agree with that.
Everything.
Because what I've found is that my primary care that decided to use an ACO REACH, which is privatizing Medicare, the way they explain it to you is because the group of hospitals that you use, the hospitals are asking them to have a global way of doing things, and that it is coming from the hospital. So yes, I think we need to study what the hospitals are doing.
So Carol, is this committee or council, whatever it is, are they looking toward legislation to get the hospitals to lower their costs, or is this the regulations, or and the insurance person would address that? And coming from a point of view of a person who has to be responsible for local league programs, I could see if we recorded something from the insurance guy and combined with Carol's PowerPoint, that would make an excellent meeting for our local leagues, combined, with questions or aims towards action, where it points to with the legislation. So it's sort of a combination of all of those things.
Well, I've talked to a few people who are in different leagues, and every league, it seems, and hey, Linda, would you agree with me on this? I'm trying to find where you
Yeah.
went away.
I'm
there
here.
you are. So when we were doing all of the emailing back and forth about single payer plans on a national level, it sort of trickled off after a while, with the idea being that everybody was going to do what their passions, where they were, and we would just move forward. So I think that there are members in leagues, La Plata is one, are pretty active right now. They're doing things within their county. They have brochures, and it seemed to me that they have their own direction. Maybe what we need to do is poll all of the counties, Beth, and see what their interest is in healthcare. And if we could get all of the counties, get a representative on the healthcare committee, which is what we have right now, we could get a sense of what people's priorities are and where they want to get educated. And then we could take it more globally to the monthly meetings of each chapter.
It certainly would be ideal to have on each of our issue area task forces, like this one, a member from each local league. That would certainly be ideal. And we will continue to advertise these to all local leagues. And, I hope, we're still early in this. This is what, our
Yeah.
third meeting?
Yeah.
So,
Yeah.
and I'm just pleased to see you all, but I agree, Carol, absolutely. Let's work on, expanding this committee.
So the other thing is that I know that you and the administration for the League of Women Voters are incredibly busy. So I'd like to brainstorm to see what we could do that we would take the load off of you, Beth, and we could just do it ourselves.
Honestly, you guys have a pretty wide berth on things you're allowed to do. If you want to create a presentation and you all think that it's a great idea, and find a speaker, and look at our website calendar to know that the date's okay, and shoot us, when I say us, I mean Laura and I, the date. We'll get it on our website calendar. We'll set you up with a Zoom link if that's what you need. If it's on our website calendar, it automatically goes out in an email blast every Friday. So
Okay.
yeah, you've really got a pretty wide berth.
Okay.
Beth, I haven't looked at an agenda for the league convention, but when we were in person, we always held a healthcare caucus, and we would do exactly what you're talking about, Carol. We go around the room, representative from each of the local leagues. What are you working on? What resources do you need? How can we support you? Can we do something together? But since we're not in person, we don't have that platform.
Mhm.
So is there any time, I was just wondering, can we link it with that meeting in May?
Absolutely.
How would that look, Beth? Is there a caucus? Can we hold a caucus? I don't know.
Yes, we can. We're we're keeping space open for caucuses in case as we always do, in case there are questions about budget or nominating or what else? Program planning. So we do have space available at 7 o'clock on Friday evening. Actually, hold on, don't quote me on that. I'm looking real quick.
I was wondering, maybe there's breakout groups on affordable housing and some of the other issue areas that would like that time and a venue in which to say, let's get acquainted with one another in this
Mhm.
breakout room. What are you doing in Arapahoe? What are you doing in Jeffco? What's Larimer leading with right now? And just kind of have a face-to-face, here's what we're doing. What would you like to see our state committee do to support you?
Great. We actually, this afternoon, Karen and Barb Winery and I are finalizing the annual meeting agenda. And right now we have a space that's at least a half hour long after the close of business on Friday night. That would definitely work, because I agree, we need more engagement.
Connection, yeah.
Yeah, absolutely. So and I like this as a way of further introducing these issue area committees to statewide membership. So that might be a great idea or a thing to do, is just put together breakout groups around each committee.
What 30 minutes to me seems a little skimpy. If you've got 10 leagues each trying to talk for 1 minute, it's not going to go very far. There's
We can
not,
I
you
mean,
don't have a minute to discuss what you're doing and then say, so where do we want to go? And what time of the night is this?
it would be 7:30. So,
Start at 7:30.
so we can go longer. We had just announced that it would end at 8.
Oh,
But that's the only thing stopping. We can say if you'd like to stay on longer or use this as an initial conversation and as a way to kind of pull people into the committees. We can also set up polling ahead of time to more quickly gather information.
and could it be, yes, I'm a delegate. Yes, I'd like to attend the breakout session on healthcare. This is a sentence about what my local league is doing in this area. I mean, it could be that involved.
Sure. I mean, we can figure out how to do that.
Would that help, Carol, do you think? With what
Oh,
you're
I
asking?
think,
with the
yeah,
polling?
no, I think it's great. I'm going to be in Houston.
Yeah.
So I could probably do that by Zoom, couldn't I?
It's all by
Absolutely.
Zoom. We're all on Zoom.
Oh, I thought there was going to be an actual meeting.
There
National,
is for national, yeah. National's going to be hybrid. And that's in June. State
So-
is going to be virtual and that's in May.
Okay, so I'm getting these, I thought, Linda, you were talking about the national meeting.
Oh,
Yeah.
no,
So the
Um,
meeting in May,
mhm.
I'll be able to do by Zoom because I'll be in Albuquerque, but I won't
Is that the
have
baby's
family and
birthday?
the birthday. Yeah.
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 Okay, well, we'd be talking about Friday, May 20th from 7:30 to whenever we decide it should end, 8:30.
Yeah.
Mhm.
I could definitely do that from Albuquerque.
Okay.
So I do have a question. Can you shoot me? How do I find on the website that the leadership team chairman for all the different counties?
That is not public information on our website for privacy concerns.
Okay,
But I can talk to you about that. Laura can talk to you about that. We can send out information to you because we already have lists put for you. I mean, because we already have lists put together.
so maybe what we could do, Linda, is email all of those folks, contact them personally through email or however, and ask them to make a concerted effort to get somebody there from their county chapter at that 20th meeting. What do you think?
We also have league leadership calls coming up. We call them that, even though they're open to anybody. But it tends to be people from the admin team that show up. Those are in early May, and we're happy to give anybody any time on that agenda as well. And that's always, we have those calls at least every other month.
And we
Sandy.
also, Carol, we also, in my Larimer League, we have developed a list of a contact person interested in healthcare in every local league, right, Elaine? So we have that list. So we can contact them and say, we hope you might be a delegate. But Beth, would it be possible for this 7:30 breakout session to be open to people who are not delegates to the
Oh,
convention?
absolutely.
So therefore, we don't have to count on delegates adding
No.
on that hour. It really can just be the healthcare interested folks.
Mm-hmm. And you know what else we can do is talk to that distro list you have, Linda, and see if we can just proactively add them to the healthcare forum.
Yeah, right, Elaine, we could do that to loop them in.
Andy?
I was thinking that maybe you should kind of go over the whole process of what you're trying to do, Beth, as far as setting up these different groups during the meeting so that people get an idea of what they're going to hear about when they go into these breakout sessions. Because I'm not sure everybody understands this concept.
I would say we would go over the purpose. I think, each of these issue area groups has a purpose statement. Give me a second.
I mean, just the idea of the purpose of doing interest groups,
Mhm.
while you're doing that.
So we have stated purpose, but not stated goals as of yet. Because, of course, LWVCO doesn't want to mandate the goals for any of these groups. So we want them to come up organically. So this purpose statement is also available in the healthcare forum on LWVCO's website. To access that forum, does everyone know how to get there? You sign in as a member. And when you do that, a new tab will pop up that's called members. And in the drop-down list is something called forums. And just click on that and you'll see a list of all of the forums that we have. A forum is a kind of like an electronic bulletin board, a place for affinity groups to share information, post information, chat, things like that.
That's
So,
what I think you should say during the meeting.
Great, I will.
Because I think probably most of us know this.
Well, and it's really confusing. Yeah, because the fact that Club Express calls this platform a forum, and of course in league speak, a forum is, a gathering of candidates. So it's confusing, and I wish Club Express had called it something else, but oh well. We got to be flexible.
They'll change it. They'll change it after we get used to it.
I agree, probably. So, okay, great.
And
Now,
it occurs to me that different ones of these committees and task forces may want to use their breakout rooms in different ways.
Exactly.
So I think it would really be up to the leadership of each of these other committees or task forces or whatever they're calling themselves to say, we're going to have a breakout room and this is what we're going to do this night. And we invite you.
Great. Okay. Well, like I said, I've got a meeting at 3:30 with Karen and Barb, and we'll be finalizing this. So I will be, I'll follow up with you all once that's decided. Did anybody want to say anything more on that topic or any more questions for Carol? What did we decide about the insurance guys?
I'd
Well,
be interested.
if we have this, I'd be glad to contact, like I tried with the Department of Healthcare Finance and Policy. I would be glad to try to get hold of him. I think if we can record what he presents to us, and then we really, get it out to the other chapters, they could have that as one of their monthly meetings if they're interested. And I would hope they'd be interested because this guy's got some interesting data and what they're trying to do. And I think this whole concept of a council that was developed under Lieutenant Governor Primavera, who I read her little bio. She's a breast cancer survivor and has been a patient advocate for a long time. And she really is sort of the ringleader of this council. This council is all state departments. I think that every chapter would benefit from learning what they're doing. And then what legislation they are proposing to bring forth what their goals are. One thing I didn't mention is that there's something called hospital transparency that was started under Trump and then was re-signed under Biden. It's a federal initiative to get hospitals to print and share what their costs are for common procedures. It hasn't gotten off the ground very well because people don't know about it. And there was a House Bill 13 something or other in 2019 that I read about that was an extension of that, trying to get hospital transparency to people before they decided where they were going to go to get a procedure done. In reality, the one thing that I think is the biggest fallacy about healthcare reform is that it's market driven. It isn't market driven. It never has been market driven. And so as a result, you can't compare, colonoscopies here and colonoscopies here if you can't go to where those colonoscopies are going to be given. So, but if you can, it's great. So that's what the transparency was all about. So you get the costs up front, then you could decide where to go. That only works if you're mobile and you have the means of going someplace else. And many hospitals have been loath to give those, give that data up, but the transparency laws dictate it has to be, is an executive order, dictates it has to
Well,
be
not
done.
only that, but they all have their own places that they're making profits off of to use
Yeah.
for the diagnostic procedures.
No. So it's, I think once you get past the idea that we are market driven, we're not. I mean, by no means are we market driven in healthcare. So anyway,
That was
so
another
we
fallacy
can,
they tried to fill us with. That's
That's
why
right,
I'm
that's
worried about the
another myth.
insurance part.
yeah, that's another myth. So when do we want to have our next meeting? Are we doing them every other month or every month?
That's up to the committee.
I mean, we got a lot going in May because of the convention, right?
Mhm.
We
We
will
would-
need to come up with some questions, Beth,
Right.
to, if you're gonna poll people, we need to have at least a few people figure out what's gonna be on the poll. Or
Yeah, that's what I was thinking. The agenda for that breakout session might be something we would want to.
yes, we need to work on
Formalize.
that.
So maybe
What
there'll
do
be
you want-
ways to meet.
Well, after our meeting this afternoon, the annual meeting planning, I will get probably through our Club Express forums. I will post to each of our issue area committees, including this one. And so you all will get that information that that's happening or not. And then, can start planning via email or via direct meeting, whichever you choose.
You were going to have Karen talk about her bibliography.
Yep, and I know Linda has a couple things she wants to talk about as well.
Okay, I'm trying to pull it up right now. I I had volunteered at the last meetings to do a little bit of research on materials that are out there, and I don't know whether Laura was able to get it posted to the forum website or not, but
It's up
I
there.
can, as long as it's there, then that'll make it easy to access. Some of these books are books that I have actually read. A number of them are. Some of these were resources that were suggested by others, and so I went online and tried to do as much research as I could to include them. The thing that's interesting is that a lot of these fall into the 2015, 28, 2016 realm. I don't think that the information is that dated, because my sense is, and I've read books from different time periods, and it seems like the questions are still the same and the issues are still the same. We're just a few years down the road. So the first section of the bibliography all has to do with either books or with magazine articles. And then there's a second section, which is videos that are available online. I think I put the link for all of them. Again, the age range of these runs from 2007 all the way to 2022, 2021, 2022. So that gives you another set with links. And then I don't know how many of you are familiar with the Canopy streaming service. It's you can sign up and get access to Canvas streaming through your public library if they pay for, I don't know whether, you'll have to ask if they pay for a subscription. One of our little libraries here in Montezuma County does pay. And so all I have to do is go in with my library card and a password, and I can watch either new entertaining movies that they brought to their website, or spend time going through the videos that pertain specifically to healthcare. So hopefully you guys will find it a fairly comprehensive list that at least gets you a start. As I said, I've watched several of the documentaries. I've read a number of the books, and although I didn't notate which ones I was responsible for, I think probably all of them are would be worth your time if you're interested in doing some additional reading.
So we go to the forum, Karen, and then look under healthcare, and that's where the bibliography is?
Yes, yes.
Okay.
Laura or Beth uploaded that for me this afternoon. So if you go to Healthcare Forum, then when you click on that, you should be able to open that document, and all of the links, unless there was a glitch in the getting it from me to Beth and Beth getting it into the forum folder, all of the links should be live links.
The links, yeah, the links all work.
But
It's an attachment, Carol. You have to look in the forum space and find the little attachment thing and click on that, and then you'll see the document. It's not up front and center.
Okay. I'll work my way around. If I can, I'll call somebody.
Right.
Yeah.
So from that list of resources, thank you, Karen. That's a lot of work. We had talked last meeting about possibly having a film discussion group or a book group or something like that. So that's another option for this committee if you so choose. Linda.
Yes, all right. So convention is coming up in Denver, hybrid, as Beth said. So there will be some delegates.
National.
The national
Sorry.
convention is coming up in June. It will be hybrid. Some people will be on the ground. Other delegates will be zooming in from wherever. And I would like to see if I can find some people from rural Colorado who are delegates who would be able to be support people for this digital equity caucus. So I don't know, Donna, I think you're kind of a rural person, aren't you?
Yes, we are rural.
Anybody from
It's-
your local league, anybody from your local league coming in person to Denver?
You know, we just had our monthly meeting today and there was brief discussion, but I think the leadership team is going to be working on who does what. So we really don't know
All right.
quite yet. I've been thinking though that, you know, we have 4 delegates. I've never been to a group where a group our size has 4 delegates. I'm so excited. So I think we'll have people there. I just don't know quite who.
All right, well, can I just ask all of you to keep this in mind and let me know?
Yeah, could
if
you explain what you mean
Yes.
by
So
the digital?
The digital equity. What I would like to do is post it all in the forum group after we leave
Yes.
this meeting sometime. I will put in the scope of it and what their purpose is so that you really understand. This stems from an affinity group on rural healthcare and some people concerned about equity with digital
Yes.
access. And they blended those two and they said, you know,
I
these
see.
go together and we can broaden our base of supporters if we bring in the rural healthcare people as well as the digital equity people.
Okay,
So
okay,
the caucus will discuss that and would like to have people with examples or challenges to be able to talk about that situation. And
Okay.
because many people who would be presenting that caucus are not coming from New York and the states that worked on it. They asked me, could you find a local Colorado person in person who's going to be there? And we will work with them to try and get their story and how it fits with what we want to present at the caucus.
Okay.
So
Okay.
you will get some coaching and conversation ahead of that caucus. And the caucuses are scheduled usually early in the morning or late at night. There's
As we
many,
just said. Mhm.
many caucuses that will happen at the National Convention, which has advantages and disadvantages because the delegate body is going to go in 10 directions at 7 a.m. and 9 p.m.
Mhm.
So we're going to be spread thin through those caucuses. And, then we're going to be virtual and some are going to be in person. So it's going to be
Oh,
interesting.
you're speaking national. Yes.
Yes, all national.
Okay, I'm sorry. Yes, we
But
will have
I
a
will follow up
delegate
with
and
that.
we plan to have somebody there. I would think we could do something. I might be interested. I'm not certain I can do it, but.
Yeah. All right. Well,
But
thank you.
as long as there's coaching and coordination
Oh, yes.
and some accumulation of, so we're very focused with what we're providing.
No, they are because they're really tightly constrained with time.
Yes.
And
yes.
these caucus leaders plan it out.
Okay.
And they're experienced people who do caucuses. So, okay, so that's one thing. Second thing is back on our healthcare, I submitted a request to have a table in our wares market for the League of Colorado's Healthcare Committee to have information about healthcare and a physical place throughout the convention where people could stop by and talk about healthcare. And we can talk with people from Oklahoma and Washington State and Florida. What are you doing in healthcare? Who are your contact people? What are the issues? Do you need resources? So number one, we'll need to staff that table. We're not selling anything, so that makes it simpler. But we do need to collect some handouts, materials, resources list, a clipboard to sign up on if you're interested, that kind of thing. And I don't know the details of when we'll need to staff that yet, but I am going to be asking for volunteers from all the delegates coming from Colorado if you would take a turn at the table.
Not just
there'll be-
delegates.
Yeah, and not just delegates. And that's a piece that I haven't heard the details of yet, how we can have a walk-in person that could just staff a table in the wares market that wasn't a delegate. Beth, what the protocol?
I have asked that, and I don't know yet if National considers that volunteering officially, which gets you free access to convention for that day, because they might see it as too self-serving. I don't know. I'll find out though.
All right, because that's key. It'd be really nice to have people from Denver, that are close in, that just want to come spend, half a day and staff the table when we're not in plenary sessions. All right, then we will also have the Healthcare Caucus, the proposal from the State League of New York for a healthcare concurrence has been recommended by the National Board, which is a real win, because that means it goes through the discussion as a whole thing. It's not an add-on. We don't have to bring it up from the floor. So they, of course, will have a caucus. And when we get the caucus schedule, you'll see that timing has been set. And they've asked that it not be at the same time as the digital equity. They don't want to split our fans from that. So that's the other thing that's happening. So I'm sorry Jan isn't on today. I don't know whether they've printed many of these pamphlets of the affordable health care or not. Has anybody seen a physical copy of that? I've just gotten it electronically. All right. Well, I'll follow up with her and see if that could be something that we would want to put on there. Otherwise, again, I'll put an appeal out. Or do you have ideas now of a resource that you think is really useful to have at the table? We could
No,
put
but
the
I'll
whole
think about
list,
it.
put Karen's list.
Yeah, well, yeah, I know that there are some things that are out there And I'll just kind of look for them, Linda,
All
and
right,
see if, and then shoot them your way.
thank
Mhm.
you.
What this committee or a resource available to this committee, whenever you so choose, is also a web page on the state website. We're happy to put that together, and it can just be kind of an ongoing list of resources. And then what we can do is create a QR code for that page
Mhm.
and have that printed on the table so that people can just use their phone.
Copy
You know,
it.
people are pretty used to using QR codes these days, and you know, it can go directly to the webpage.
And we do have an extensive toolkit for the national network that could just be posted on that page.
Great.
I mean, that'd be really simple and straightforward, I think, to just
Mhm.
put that up to start with and then add on Karen's document.
Hi, Elaine. Thanks.
Okay.
Great.
All right. Well, I'll follow up on those couple of things. And then, you know, I think our Beth, are you collecting names of all the delegates to the national convention from the state local league?
Yes. We haven't asked yet,
Okay.
but we will be, because we will want to get delegates information
Sure.
about concurrences and, you know, things like that.
And your offer of housing, have you had? vendors?
Yep, that's on the list too.
Okay.
So,
All right. Well, we've got our delegates in Larimer set now. Some are virtual, some are in person. Maybe other local leagues will make that split too.
Mhm.
mhm.
Okay. so
Okay,
we-
Elaine, was there anything else from the national that we should?
Elaine just had to leave.
Yeah, she just left. Okay. All right. Thank you all.
Tell me again,
Okay.
our resolution that we're going to present is for,
Election security.
isn't there one, the one for healthcare?
We
That's
don't,
New York State.
New York State, it's a
single payer.
concurrent, it's a concurrence, not a resolution.
Oh, okay. For a single payer?
It's like an update to our healthcare position. It goes into some of the areas that the earlier position did not address. So the caucus will explain it
Oh.
further. And we also have a presentation on our state league website here of Colorado that was
Yeah.
done for us earlier that you can watch, that video recording of the
Yeah, okay.
explanation.
I was there, I just don't remember anymore. There's been so much since. then.
Well, that's why we have a video archive.
Yeah. Yeah, I'm looking to get the link in the chat box right now.
Yeah. All right, well, those are the three
Okay.
things that I'm thinking about from the national.
Great. Excuse me. Anybody else?
When are we gonna meet again?
Good one. Let's see, a month from now is just before a state annual meeting.
Be 10 days before, right?
About that. So, or if you wanted to look at afterwards, but before national, we could do the last week of May, early June.
I guess to get organized for the state meeting
Great,
breakout session seems reasonable to me.
that makes sense.
No,
So,
How about is May the 10th too early?
no, that's the time we're talking about.
Okay.
Tuesday, May the 10th.
Mhm.
As long as it's a little bit later, that's our regular meeting time, but 2 in the afternoon or on would be fine for me.
2 o'clock was when we met today.
Mm-hmm. That worked well.
So 2 p.m. May 10th.
Mhm.
Got it. We will get it on the website. And start promoting it. Does anybody from this committee want to speak at the leadership calls that we're having in early June for any reason? Or I'm just happy to make a plug for the committee, for all committees.
Excuse me,
Yeah.
Beth, isn't that May 5th and 6th?
That's correct. What did I
Okay.
say?
I just wanted to clarify the date. Thank you.
Great. Okay, I will just plan on making a plug.
Karen, do you think it would be more effective if one of us were on that call just briefly?
Can't hurt.
All right, well, I'll be willing to do that if you just let me know what time.
Great, great. Okay.
Okay.
It's on the state website, is it not? I believe it is in the calendar.
I believe it is, but I'll be sure you get an agenda, Carol.
Yeah, because I don't need to be there the whole time, just,
Nope. Nope.
Yeah.
But they're pretty chummy calls. They're it's fun. Actually, you might want to stay.
okay,
Pretty helpful.
warm and fuzzy, huh?
Mhm.
So just for my clarification for my notes, we're talking about Carol coming to represent the Healthcare Committee at the leadership meetings, May 5th and 6th, correct?
Correct.
Okay, thanks.
Okay. Anything else?
Thank you,
That's it.
Carol, for that presentation. That was wonderful.
Sure.
It was just
Yeah,
very
thanks, Carol.
informative. I think it's something that everybody should know about.
It's
Good
very
meeting,
helpful.
Beth.
Thank you all. Appreciate it. And Carol, yeah, if you'll send me that PowerPoint,
Sure.
I'll get it posted.
Okay, very
Uh,
good.
Cool. Okay, great. Thanks a
Thanks.
million. I will let you all know about the breakout groups at annual meeting and if manning a table in the wares market counts as volunteering. So,
Okay.
okay. Thanks so
Well,
much, everybody.
Thank you,
Bye.
Beth.
Thank you.
Bye.
Okay.
Bye-bye.
Bye-bye.
Oh, God. The meeting.